some of the major developments we're tracking. Confirmed coronavirus cases around the world now closing in on 19 million, with more than 707,000 deaths globally, as cases in the hard-hit U.S. climb toward the 5 million mark. With me starting things off, ABC Chief Medical Correspondent Dr. Jen Ashton. And Jen, we all know it's that time of year, students heading back to school already in several states, others preparing to do so. There is so much anxiety out there about children and how this virus affects them. What do we know?
Well, at this point, Amy, this is obviously a special population that we are learning more and more about literally every single day. But here's what the data shows us thus far. In general, when you talk about the pediatric age group, ages 0 to 18, they are at lower risk. That doesn't mean zero risk, of course. According to the American Academy of Pediatrics, they estimate that the risk of hospitalization in this age group ranges from just over 0.5% to up to 9%. And the risk of death, according to the CDC, is less than 1 in 1,000. Two important qualifiers here, Amy. Number one, when you hear stats, particularly about kids, we have to remember these are not numbers, these are lives. So very, very important to keep that in mind. And also, just mathematically, even a small percentage of a large population can add up to be a significant number.
That is a very important distinction to remember. So there are still a lot of unknowns, theories about kids and this virus. What are those?
Yeah, and in terms of the medicine and science, recently published data has really outlined or defined a couple of key theories here. These are unknowns, but there does seem to be or suggest that there is a difference between different ages, with a cutoff being at 10 years of age in terms of their chances of getting infected and the severity of disease if they do get infected. It appears, or there are hints, that younger children may actually be less susceptible. But again, how often are kids or teenagers spreading this virus to others? That is a big unknown. So there is a lot in terms of the medicine and science that we are still learning in real time.
All right, Dr. Jen, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.